Welcome to another episode of StudyMEDIC Podcast. We have Dr. Soumya here, co-founder and CEO of StudyMEDIC. Welcome, ma'am.
Hi, Mithun. How are you?
Yeah, I'm fine. How are you?
All good. Thank you.
So today we are going to discuss why most of the doctors fail in this global medical exams like MRCUG, MRCS. The success rate tends to be very narrow. So do you think why is that?
The main issue with these global exams are because the way they assess the students are quite different. And as such, as you know, medical education, there is no uniform global system. Even though we read the human body, we know how to treat them, each country has their own specifications and how to assess and things like that. So once the students, because this is a global exam, obviously, so from the way you have learned to adopting a new system takes some time. But if they understand the gist of how to apply the concepts and the knowledge, then it is a cakewalk.
So the most of the doctors fail. There is only a narrow person who pass. Even though they are studying the same syllabus in their home country, they are still finding it difficult to actually achieve success in these Royal College exams or any other global exams. So what do you think what's the difference?
See, the main thing which is different in any of these global exams are the way the exams questions are set are quite different. Okay, so even though we do have a knowledge, the more of conceptualized questions, specifically, generally how the Royal College exams runs is the entry level is always easier. But when you move to the next level, they want us to be very thorough with the guidelines, and also it is not that they are asking you to rephrase or remember and put that statistics. What they want is, if the patient is coming in, how do you apply this guideline to that particular patient? So you are supposed to apply the knowledge what you have got. So that is where people should know a bit about how to apply this knowledge. Because we all read the same thing, we all remember them well, we are all treating the patients also. But in each home country, there are very different ways how we apply the knowledge. And when you come to the OSCEs, the thing is probably each country has their own OSCE different systems. It is a perfect combination of communication, ethics, and technical and non-technical skills. And also they are all time framed. They might have 15, they might have 18, they might have 14, they might have 10 station based on the speciality, but they're all time frame, like 10 minutes, 5 minutes, 8 minutes. So that is why the challenge comes in to combine all the elements, put it in one frame, and then present that you have to showcase that you are the safest doctor.
All right. So I think thanks for clearing that up. So it's actually a bit of a mentorship. Like you need to have the know-hows of how to present your knowledge.
Exactly.
It's like you need to be able to convey that you know this is
Correct.
how you are going to.
Correct.
So that is what is the missing link between
Yes.
success and a failure.
Correct.
All right. So we also have so many doctors who pass these exams on their first try. So do you think what they would have done differently, and how can someone say like me who has not cleared the exams, how can I do that? How can I?
Yeah. See, the thing with the doctors is we are all extremely professional, very busy, and we hardly get time to read. Okay. So in the limited time hours, how do you utilize the quality of the timing is important, because we don't have quantity. Probably everybody gets 1 hour, 2 hours, and some days it is you cannot even open anything and do. So what we are trying to do is we are integrating this syllabus in a very comprehensive way and which is easily accessible. Okay, so you need not open the books. Like we have moved from traditional to the most easier technology. We are all just one click away. So in between, while you are seeing a patient or you have some time, so you can actually review, revise and do things quickly. And also all this voluminous syllabus are broken down into lots of audiovisual formats and micro learning modules, which makes your life easier. And also the assessments. See, the point is, once you read, you feel like you know everything. Once you start applying in mocks, that is where you understand where do you stand. And the dashboards helps to understand where actually your loophole is. So that's for the theories thing. And for the OSCEs, because you are going to present continuously to the mentors. Okay, so for us, I think mentors are the ones who are the backbone, because they handhold and the holistic support. Because constantly for us, because we are so busy with professional, personal, social life, You need somebody to tell, okay, you can do it, don't worry. So that sort of motivation and hand holding makes a lot of difference. And majority of the students who are able to pass it first go is purely because they would have done the same things in a limited time in a systematic manner, and they would have revised in a very effective way. So that's the whole point. Otherwise, everybody reads the same guidelines, everybody gets the same questions, but how quickly you can revise, how well you have been, molded to that frame makes a lot of difference.
So, in summary, you need to have emotional support or the mental support from the mentors who have done it in the past, and you need to have a structured learning.
Correct.
Like you need to practice, revise, and repeat, and you have to apply these knowledge.
Correct.
In a systematic way.
Yes, true.
So, if you do that, it is quite possible, so that you can clear this in the first attempt itself, right? Thank you, ma'am. So, say if I'm a person who want to take this exam, but I am postponing this. I know, like, I think that I have a fear of failure. So what should I do? Like, what should I do right now?
Yes, this is a very common thing. People do take the courses, people do book the exams, then they postpone, then they cancel, they reschedule, because we all need to have that frame of mind first, and also that amount of time which you can spend for this. Because as I said, life runs parallel to all these global exams. It is not that it is a must in your career where it is blocking your career. Majority of the doctors who do these global exams are somebody who is already a consultant. This is just addition, are making them an evidence-based doctor. So that compulsion, unlike your MBBS or post-graduation, you have a limited time, you know that you have to clear. So there is no compulsion like that. So that's the first thing where people book the exam due to some things, and then they take it casually and they get worried. What if I don't? That fear of failure is something which is huge, basically because you are you are looked at by so many people as a fantastic clinician. So you don't want to fail there, right? So that's one of the main reasons why people don't want to take, because they want to make sure whichever the attempt they take, it is a pass success. Yes. But what I always suggest all the candidates is to try, because these exams are addition to what they have got, right? So ideally, whatever the time frame they've got, if they could map systematically, okay, and also if they could revise whatever the way they can, and if they can apply that knowledge, if they get involved in the discussions, if they do justice to their preparation, majority would still sail through. But that fear of failure, somewhere you have to break it, okay? It is not that you sit and study for 1 year and you are guaranteed to pass. That never happens. What I have seen always is the busiest of the busiest clinicians are the ones who pass, because they get less time and they start applying to the patients who come in. So that part, every student, every champion, whoever comes to us, we always say that, think when a patient walks in how you are going to apply the guideline, because then it becomes your lifestyle. Once these guidelines, once the way you communicate becomes a lifestyle, then passing is always easier. It is a small changes which you need to bring into your own clinical practice, which will bring you confidence, and of course, because they are voluminous. So, you are supposed to be repeating, reading. I won't say it would be easy, but it is very much doable, because majority won't get leaves. Majority would be working like even on the previous day, I've seen people working and going and giving the exams, because our profession is like that. So, and the stress, what they carry is too much, because already they have got so many things. So those are the main reasons why people don't want to do it. But I would always say it is worth doing with all this, because finally once you are successful, it comes with its own charm and the benefits.
Yeah, the charm and benefits. Yeah. So what do you think is the difference between the Indian medical system and the global medical education system? What are the pros that you are gaining? Is it like, I think it's most like communities and seminars, and it's a continuous learning. So
I would say that both the systems are almost the same, but there is a tweak, because as I say, each country, the way you treat different ethnicities, different patients is quite different. Like, you cannot treat the way you treat an Indian patient to the UK patient. You cannot do the same thing to the US patient, because we all come up with our own values and ethics and things like that. And also, even the insurance systems are quite different. So you are more prone for litigations outside India. In that way, India, we have a lot of patients who teach us so many things. Okay, we are blessed in that way, the amount of case exposure what we get. So we learn through our patients, and of course we learn through our fantastic teachers who teach us the surgical skills and all that. When you come to the global systems, there is a more importance to how safe you can be, doctor you can be legally, I mean, because we are all taught the same thing, to be a safe doctor. But how well you can tweak your communications. Here also we are taught that, but we are refined. Okay, and you will be, most important, when you take these global exams, you will be able to touch the areas of your expertise where probably you wouldn't want to do it here. Like, for example, if I'm talking about OBG, the specialities like oncology are probably like menopause and HRT, where we see less number of patients in that unless you do a specialization. There you are confident enough because you are covering all the parts. So you are able to do your basic counseling. So this adds a lot of value when you read, because you are reading. So you are evidence based. So you can actually counsel the patients better. You can document better. So in future you can be protected from legal issues also. So all that matters. It is, I would say, it's an add-on to what you already know. And you can be confident that you are trying to tell the exact things to your patients, and you will feel satisfied that you are doing the best to your patients.
All right. So how is StudyMEDIC as a venture going to help all these students who want to clear this coveted examinations? How can we make sure that we can help you? It's almost like we have taken a huge responsibility.
Yes.
Right. It's not an easy exam to pass.
Yes.
It's not like you can come here, even though you know this
Yes.
you know these things. It's not that you are not guaranteed success.
Correct.
Then again, we are guaranteeing them success. How is StudyMEDIC able to do that?
See, the thing is, I think StudyMEDIC, the basic values and ethics what we hold is to make sure that you are made the best of yourself. Like, we will make sure that you become the best version of yourself, because all these doctors, they're already the cream of the society. They know very well what they are doing. They already have that enough knowledge. So the tweaking is what is difficult, because in adult learning we have learned something. So now to tweak to a different new system where the challenges are faced, because probably we are so much used to traditional methods like the textbooks, including me. Even today, I'm very happy to go through the textbooks. But right now, it's all in your tab or the mobile or the one click away. That change, I think that transition from traditional to the newest one, we have made it very easy through the mobile apps, through our LMS, which is, even because I have got lot of students who are like 60 plus, but they are very comfortable. They have started learning their things because they have realized the syllabus, if you want to carry the textbooks, because when I travel for MSUG, I know the extra luggage which I paid was completely for the books. Okay, so I know those practical challenges because we are happy to read and mark and write it down. So we have provided a system, the LMS and the mobile app, which is updated, and they know where to make a notes, they know where to, you just need a mobile or a tab. Simple, right? And the second thing is, when you have been taught things, okay, so there are a lot, actually we all know the same things, because the guidelines might be a little different, but we know exactly what to be done for a patient. But identifying the concepts, why you need to give this medicine to this patient, we are already aware, but why you shouldn't give this, those things makes it very clear. So the concept of applying for day-to-day practice, once a patient walks in, I know that I have to assess her VT risk. So my guideline comes into mind all these risk factors I need to assess, whether this patient is at a risk or not. I know during the consent, I need to tell all these risks. During the procedure, I need to think of all these safety points. During the post-op, I need to mention all this in the documentation. That thing, once a candidate learns, they will 100% pass this exam, because that is what the college is looking at.
That is what is missing in our system as well, right?
It is there, but
we are not enforcing.
Exactly, because our system of evaluation is totally different. And once they know all of this, they can pass the theories very well. And by default, you need to know to communicate in a very sensible language, which is, I am very happy to say that once people start taking the global exams, the way they communicate to the patients, the way they communicate to the juniors, the way they communicate to the seniors is totally different. So I think where we are coming from there is because we have our own OSCE apps where we ask them to send the recordings, we assess, we make sure we tell even the non-verbal communication, how they are sitting, how they have to have eye contact, all these small tweaks, because the knowledge they already have. Once you clear the theory, you know what to do. It is just the small tweaks which will help them to do better. So these small suggestions, daily enforcing and telling everybody in the group that you can do it, it's okay, because we all face so many challenges. Probably, I have always seen people who have got the challenges like somebody lost their loved ones, let it be a parent, let it be a kid, let it be, they have been diagnosed with cancers. Those are the candidates who 100% pass these exams. Because I know myself that when they come to the mock exams, we always see them being warriors. Because that capability of doing things, if they can do, others can definitely do. And the face-to-face mocks. That's the beauty of StudyMEDIC, I would say. We are the one who have initiated, who are carrying on in India and abroad, and we have got a huge success rate because the amount of energy and the passion we put in, I think that is visible in the results itself. So I think it's a perfect combination of managing the theory very well and getting into the OSCEs, and also the schedules are placed in such a way that even if you cannot attend for various reasons, because as doctors we will have a lot of commitments, so you can come back and attend the recordings, and you can ask doubts to the mentors anytime, and the teams are always there to help. So I think that hand holding makes a lot of difference. Otherwise there are a lot of education platforms which are doing good, but probably we stand out because we value their time, their energy, and make sure that they become the best version of themselves.
Yeah, so I think anyone who's want to clear these global exams, you would have got a perfect idea about what is wrong, what is right, what should you do, and what we provide. So if you want to know more regarding our courses or our LMS, or how in general, what can you do, you can just ping in the comments, send us a DM or anything, we'll respond to you. I hope this was helpful to everyone.
Yeah.
And thank you, ma'am. Thank you for your time.
Thank you so much. Thank you, Mithun.